think people joining is beginning to slow down just now, so I will kick off. Yeah, I'll kick off just so as we're not hanging about in awkward silence for too much longer. For any of you that haven't met me or that before, I'm Stephanie Stewart. I'm the Senior Improvement Advisor working on that standards within Healthcare Improvement in Scotland, and I'm going to be chairing the session today. I thank you all for joining us, and hopefully, we are beginning to get a wee bit of sunshine after the thoroughly wet few weeks that we've had, particularly for myself on the East Coast. So I'm really glad to see the sunshine today. So before we kind of sort of start the session, I'll just go through some sort of general housekeeping and whatnot for today. So as Leanne's popped to the chat, if you are able to pop yourselves on mute and switch off your camera, it's just to really help with the kind of call quality and to stop things dropping out. There will be an opportunity to kind of pop your cameras on and open your mics during the Q&A sessions after each speaker. So please do use that as and when we're at that point. We'll also be using the chat function today as much as possible. So if you do have any sort of comments or questions, please do pop them in as the speakers are talking or at any point, depending on what it is you're after. If we do get to the end of the Q&As and we don't have time to kind of cover everything, don't worry, we will liaise with the speakers and circulate any answers kind of post-event. And also, if you do have any sort of technical difficulties or whatnot, just email his.matt@nhs.scot and one of the team will be able to help you and hopefully get you back online. The session is being recorded, so that will be available laterally as well. Just in recognition of the fact that we do work in a particularly kind of emotive context, there may be content today that includes accounts of personal experiences across alcohol and drugs which may be triggering. So please do look after yourselves and everyone in the room. And if at any point you need to take a break, please do so. Don't feel that you need to be present for the full session if it would be helpful to take a break. Also, if you do want to contact us privately instead of using the chat box, please do use the his.matt@nhs.scot email address for anything at all. So just to kind of go over kind of what we are going to cover today, we're going to start with a quick poll to just really kind of take a few moments, I suppose, to reflect and kind of take a break as well, because it is important that when we're running about from meetings to meetings and everything's so busy elsewhere, it's nice to just have a wee bit of time to sort of reset before the main speakers. We'll then move on to our first presentation, which is from Ailsa, Jane and Chelsea from Lomond Argyll Advocacy Services, and they're going to present their experience of their recovery rights-based advocacy work. As I said, there will be time for Q&As after their presentations and also for you to share any sort of thoughts on what's been covered. Following this, we will be hearing from Laura and Lynne from NES, and they're going to present sort of resources and training to support sort of trauma-informed practice, mental health and well-being. And again, there'll be more time for sort of Q&A. We're aiming to take a sort of short refreshment break, apparently I can't say that, at 10 to 12. And again, just as I say, feel free to take that time, get away from your PC if you possibly can, and even have a wee 5 minutes outside if that's doable. So following the break, we'll be hearing from Frank from Kairos Community Trust, and he's going to share how they're supporting people on the recovery journey, ensuring it meets sort of each individual's needs. As before, use the chat function throughout presentations and also ask any questions as well at the end or make any comments. Finally, we're going to hear from Tamara Thorne from Population Health Analysis within the Scottish Government, and she's going to be sharing a survey in relation to the stabilisation consultation. As I said, at any point during this session this morning and into this afternoon, please feel free to put any questions or comments in the chat. So as I said, I just want to start the session today with a bit of an opportunity to kind of reflect on what people-led recovery means to you. We're going to launch a poll, and if you can take a moment to sort of think about this and respond, and in a concise way, hopefully, so as we can be able to kind of pull that information together. What 3 words come to mind when you're thinking of people-led recovery? As I say, we'll just take a few moments for you to respond to that, and the responses should come up on the screen as people add that in. This is great. Thank you for sort of taking part in this, and please feel free to continue contributing to this as I kind of chat through what's coming through. What's obviously coming through is loud and clear is that choice element and sort of that compassion and empowerment as well. So that's reflective in terms of what we're hoping to cover today, and hoping that you will hear from the speakers as we go through. But certainly from a programme point of view, it's nice to see what people are thinking, so as we can obviously support things as we're going forward with the learning system, not only with during the webinars, but also by wider resources as well. So thank you for that. And hopefully, as I say, it was nice just to take a wee bit of a break and not have to think too much in response to that, and to think about what drives us and what brings us to these sessions when they are run, and what brings us to actually doing the work that we're doing. So welcome our first speakers of today. I'm going to hand over to Ailsa, McCrae, Jen, Methven and Chelsea Willis from Lomond and Argyll Advocacy Services. As I said, please do utilise the chat function as they're talking, and like that there will be an opportunity for Q&A at the end as well. So I will hand over to you ladies, and I will give you all a break from my voice.
Good morning, everybody. I'm Ailsa McCrae. I'm joined today with my colleagues Chelsea Willis and Kintyre and Jane Methven over in Dumbarton, sort of Helensburgh area. It's good to be here, and it's good to get an opportunity to talk about the work we've been doing here in Argyll and Bute in West Dumbartonshire. Can I have the next slide, please? This is just a wee snapshot of some of our team that are working across, and a kind of idea of the kind of, when we first thought about the project and what it might look like, what we thought we would be doing, and we took those views from the people that we spoke to, that advocacy should be all of these things: supporting, community, respecting and rights. Next slide, please. So today we're going to just talk to you, opportunity here a wee bit from our lived experienced advocates, just about how we work and how we think our role's going to be making a difference. And have a wee look at the headings there. What we're kind of talking about is a project that's been in existence in Argyll and Bute for about 2.5 years, the Recovery Advocacy Project, and our rights-based advocacy service is more newly started. It's probably been about a year it's been operating. But I'm going to hand you over now to Jane, if I'm right. And yeah, Jane. So can we have the next slide, please?
Hi, everybody. I'm Jane, and I'm a recovery advocacy worker. I work in 2 localities, so I'm in West Dumbartonshire and Argyll and Bute as well. I come with lived experience, and I can understand how people can relate and bond better with people. I'm a worker with lived experience, and there's definitely a difference in working with peer workers. It makes you feel less inadequate, embarrassed to open up, because you feel ashamed through the stigma others. As a lived experience worker, I have found that when people who are in the middle of chaotic times, when they realise you yourself have been there, it's just, they come with you, and you can they gel with you, they bond, they'll open up, they'll tell you things that they have never spoken to other services, never about. They see that you've got there, you've achieved goals, and that makes them, they'll sit back and, like, I want a bit of what you've got, so what I do is I go around quite a lot of services, but one in particular that I work with, I get a lot of referrals from. It's a kind of homeless hostel, and I had got a referral last week, and it was for a young lady who, she's been in addiction for 6 years. She's been homeless for 2 months and lives in this hostel. She was caught with street violence within the hostel, and 3 times, and she had a letter of eviction. So I met up with her last Friday, spent an hour and a half with her. I spoke a wee bit about my past as well, you know, and the things that she told me, and she was worried about the eviction, and asked her, you know, she has an addiction worker, she's just never been offered or given the options or choices, and she wasn't aware she could go to rehab. So we sat and we explored this young lady's choices. And now we have an appointment next Thursday, you know, to go to the addiction team to see about getting her into rehab, which is absolutely fantastic. And that was just through sitting and telling her about the MAT standards, about her rights, which she didn't even know they existed. But yeah, I definitely feel, and especially with the lived experience, that you connect a lot better with a lived experience worker. Next slide.
Hi, I'm Chelsea, and I'm based in Kintyre for the Lomond and Argyll Advocacy Service. At the Lomond and Argyll Advocacy Service, we're issue-based, working independently with individuals and a range of issues. Some of these are listed in the screen, so I'll give you a wee second to have a look. The issues we assist with can range from anything from supporting a client to a GP appointment, just to give them that wee bit of confidence to speak up for themselves, to attending a housing appointment with them and having pre-meetings to make some notes and bullet points so that they know that what they're going to say ahead of the time. We want to make sure that our clients' voices are heard as much as possible, and these are just some of the examples of where we can help on a day-to-day basis. There's lots of other ones, but I'm sure you can think of some yourself as well. But this just gives you a wee chance to see how varied our working day can be. Next slide, please. I'm sure as professionals, most of you will know what the benefits at advocacy are. Some of them are listed here. Again, I'll just give you a wee second to have a look through. As an independent advocacy service, we are human rights defenders. We challenge inequality and fight stigma at every opportunity. We work with clients on a daily basis to ensure there's inclusion, ensure voices are heard, and build trust and respect with their clients to assist them to get the support they require and feel more connected in their community. Next slide, please.
Hi everyone, I'll just give you a wee minute to look over and we'll talk a wee bit more about putting rights into recovery. So within my role, we are right up for rights-based and we defend everybody's rights. We recognise and safeguard everyone's rights to be heard, reducing the barriers that people in addiction often, they face them alone. So the MAT standards, the rights, respect and recovery strategies state rights that individuals seeking recovery has, along with our own human rights. As right bearers, I encourage my clients to make informed choices and challenge duty bearers. For example, a lot of people who have been on, you know, methadone kind of all their life, some prescribers, I'm especially working over 2 localities, I see a big difference, you know, with the MAT standards. And in Argyll and Bute, it's very, very hard to be prescribed it, and it's a barrier to recovery, and that is to be prescribed Buvidal, because at present Helensburgh there's one prescriber, which is nowhere near enough. It's absolutely nowhere near enough, and people they're still continue to use because, you know, that the stigma. You go to the chemist every day with a Buvidal injection, they're going once a month, so right away that's it's really crying out in Helensburgh, and it needs to be done as soon as possible. I do inform everybody about their rights, and that makes a huge difference. And if the MAT standards are getting adhered, you know, that challenging other services, their duty bearers, and be giving them a sense of achievement by setting goals, and that's not going to happen until we get this in Helensburgh. We need more prescribers. And this in turn would enable people, you know, to reach out, they'll go for help. A lot of people aren't going into services because they've been putting on methadone prescription, and that's not what a lot of people want in Helensburgh. So I educate them about their rights, especially the MAT standards and options of treatment. And because we're empowerment, that brings the confidence to reach out and get help. And that's why I'm so passionate about our role. Thanks for listening. Next slide.
So this slide's about the challenges for delivery, and as a service, we've faced many of them. People don't always understand the role of an independent advocate. Along with other factors, this often contributes towards challenges we face within our service. If you want to just take a wee second to have a look over that, and then give you a bit of my experience. So for my project based in Kintyre, we started a little bit later than Jane and my colleague Jamie did in Helensburgh and Bute. And Jane and Jamie kind of hit the ground running when they started. There was such a need for the service in those areas. With Kintyre, it was a little bit slower. I think the main reasons towards that were the stigma between the locals and the challenges that we faced connecting with services in the first place. I had lots of experiences of trying to get my posters up in shop windows and getting refused. Even the chemist, it was quite a challenge to get them to understand our service and see the good that we were doing. Over the last couple of years, we've definitely worked on those stigmas and those challenges that we've had with the services, and now we've got great working relationships with lots of local services, and we're getting referrals from lots of different pathways now. We're also getting referrals through word of mouth through clients that have worked with us, and they're telling their friends or family members about them. So it has definitely picked up. But as you'll see from the list here, some of the challenges that we face, it's very varied, and we just keep promoting it and doing as much as we can to get our name out there and help as many people as possible. Next slide, please.
Thanks very much, Jane and Chelsea. I certainly know from speaking to service providers and individuals that phone up the differences that you guys make in giving people that kind of self-belief, that the sort of feedback from service providers when they're making referrals, they know that they're looking for advocacy because they themselves are advocates, nurses, doctors. But at times they recognise there's great barriers to the independent advocates, great benefits, not barriers, benefits to the independent advocates, being able to take things a kind of distance, take things further to be able to get somebody heard, because often you hear from nurses that they don't feel that the service or the provisions that they have available to help people are not adequate enough. And they're just reaching out, hoping that we can enable and support the person. One of the things that we've kind of observed since we started this project, I've worked with Lomond and Argyll Advocacy Service, I believe, for about 15 or 16 years. I'm not really too sure. But we've generally always had more females be in touch with our service, always. To our core project where we provide advocacy to kind of individuals with mental health issues and support people with other pieces of legislation like EWI and that. But the greater number of referrals have always come from females. But the tables have turned with this project. The very early days, it took quite some time before we got a few referrals from females, but it's still staying predominantly males that are in contact. And that's something that's a concern for us because we know that there's women out there that would benefit from our service, but we know that there's many more barriers perhaps for women to be able to reach out and ask for help. And the main one that strikes for us often is the discrimination, the stigma around about asking for help, and also where they'll be seen as very vulnerable if they've got a caring role for family members or looking after children. They may well feel vulnerable to seek support. So it's, I think, be really good to explore how we can enable these women to be able to access support. Can I have the next slide, please? Here I've kind of drawn out a kind of where the age group of the numbers of referrals. So our greatest referral age is people between the age of 41 and 64. But what I hear from advocates all the time is these young people that do get in touch, these younger people, I want to do more. I want to be able to assist these younger people to try and prevent them having years and years where they're struggling with an addiction. And we know these addictions can be destructive to people's lives. They can have such negative impacts. So we really are going to focus our attention a bit more to trying to reach out to younger people as well. What more can we do? How can we engage with education services and young people's sort of forums to promote that there is other options, there is ways to be heard, and there is ways to ask for help. And I think often it's the asking for help that's very difficult. Can I have the next slide, please? It's just a wee picture of where our referrals come from. The sort of dark blue areas, Argyll and Bute, and the other areas kind of showing you where our referrals come from in Western Bartonshire. There's a great number of self-referrals. Certainly in Argyll and Bute, we've had 82 people that have reached out themselves, which is fantastic, that networking, and that's grown in Western Bartonshire. This project is further behind anyway, but the number of self-referrals continues to remain the highest way of people reaching us. So it's really, really important that those working in services have what information, are able to share it with people so folk can make that choice, putting more posters up in your service where people can read about advocacy and maybe think that's a service that could help me. Can I have the next slide, please? So going forward, we're always going forward. We're always thinking about what can we do next, what different things we can do. And I have to say, I work with a team that are always up for looking at different ideas. Very recently, we were in Kintyre after an event that had been there, and one of the things that came out of that was getting some kind of walk set up, raising awareness in Kintyre. It was absolutely fantastic to be part of that. We're always supporting kind of ideas across the team and different things, and this is the thing that I struggled with to begin with. We've had to think differently about advocacy to reach the people. We've just had to, you know, I would say, well, what would walking got to do with advocacy? What's some of the things that we've tried to do got to do with advocacy? What they've got to do with it is it's happening in the community. It's for everybody. It's about getting the knowledge and the information out there. So going forward, we're hoping to be just making sure we're along at more peer support groups, places where people are supporting events and awareness, and we use our social media pages to share things that are happening all the time. We've got a recovery advocacy page set up, and a number of people have used us, or families that are concerned about a loved one have also kind of liked that group and follow it, where we share information. We've been providing some sort of education in terms of to our community self-advocacy skills. That's something that we'd started doing maybe about 5 years ago, but we've adapted that and we've tried to provide that to people that are working with us, that have been working with our recovery advocates. So we ran a workshop over in the Isle of Bute with 14 people, I believe, attend, if I recall from the day, and it was a very different workshop. There was 3 people there at the start of the day, and by maybe about 11:30, the majority of people there, but there were still people arriving at lunchtime. There was 1 or 2, and I think it's about being open and inclusive, that you can come in, even if somebody's just getting that last hour of the workshop. That was important, hopefully going to make a difference. It's about recognising that it's not all going to be as we'd like it to be, and we're going to have to adapt and think. So the plan is, we've just delivered self-advocacy skills course down in Kintyre, which was well attended, and we're hoping to do that in Helensburgh. And that kind of funding came via Cora for us to, we said we'd do that as part of our bid for funding for advocacy. We're going to be thinking about opportunities for people to learn about their addiction too, how to manage it, how to stay well and things. And we'll not deliver that ourselves because we're not experts, but we'll work more with health around about that and making sure that we've got information that we can give people, even if that's information in naloxone. Where do you go and find out about that? We we ourselves are always trying to improve our own knowledge, so attending things like SRC and the SDF training and just boosting our own skills and learning. And kind of moving ahead, we'll aim to kind of do more about raising the awareness of MAT standards, hopefully making our community know more. It's not just about people accessing services, but it's about third sector services knowing more about MAT standards and helping guide people to the right people at the time that's right for clients. So the more awareness there is, the more people that are going to be supported and helped. Next slide, please. This is just we probably are getting close to the end of our time, so this will be one of our last few slides. This is the recovery walk in Perth. That was the first recovery walk we had attended. And all the folk there in blue T-shirts had come along to volunteer and work with us that day. But every single member of staff there came off their own back because they wanted to. Nobody was coming along and getting paid for the day. They didn't want to. They wanted to be there and they wanted to come with their families and celebrate and promote recovery and have an awareness together. And that tells me so much about just the people we've worked with, and it's stayed like that. That's what folk want to do. They want to be at the heart of things and connecting with people, and I absolutely value the passion and the determination to make change that my colleagues have brought to the work we're doing. And I do love those little kilts. I can't resist saying these wee ones, just all connecting with other little ones that were there with their families, celebrating recovery, and just others there remembering ones that maybe haven't made it. It was such an important day. Next slide, please. We created a little book called The Stories of Hope. Stories that clients told us about their time working with advocacy. And if you wanted to see that, I'm sure we could arrange for a copy to get to you. But in amongst it, we've tried to share stuff about other services that can support people with their recovery. And it just, the idea is meant to be MD that's working with us, that's having a really difficult day, can pick it up and see words of empowerment, words of encouragement, stories of hope, and actually other services that could reach out to support them. And they're just some pictures from the day from different people that have kind of supported the development of that. Next slide, please. So that's just a wee bit of feedback you could read that's been given to some of our advocacy workers. We tend to run a satisfaction surveys every now and again and gather feedback. I think I hear the same sort of things all the time. I really felt I had somebody on my side. This made a difference. I never thought recovery was possible for me. Your advocates saved my life. I've heard that a few times. This is what I needed. Somebody to come with me, somebody to be there. Next slide. Thank you very much to everybody, and a huge thanks to all of you guys for listening to us, for the opportunity to be here, but a massive thanks to Jane and Chelsea for sharing their experiences of the work and the differences they're making. These guys are the guys that are making the difference to people. Thanks.
Thank you, Ailsa, Jane and Chelsea. That was really interesting to hear, certainly about your experiences, and also the that need for sort of individualisation and support, and ensuring that people know what choices are available to them, and helping to support them to actually make the decision that's right for them, as opposed to what other people think might be right for them. Unfortunately, we have ran over a bit, so what we're going to do is, if you do have any questions, please do pop them in the chat and we'll collate them and liaise with Ailsa, Chelsea and Jane to get them answered. And obviously, if you guys in the meantime want to answer any of the questions that are sitting in the chat, feel free to do so. But as I say, latterly, we will pick them up at the end and get responses back to everyone that's commented and asked any questions. So please do feel free to pop any further questions in the chat. In the meantime, I will move on to our next speakers, who are Laura Freeman and Lynne Bradford from Bradford. I don't know what was going to call you there. Apologies, from NHS Education for Scotland. So I will pass you over to them. And as I said before, please do use the chat function as they are presenting. Thank you.
Thank you so much, Stephanie. This is a hard place to actually follow, Jane and everybody else. Thank you so much. What we're going to talk about today is how do we take this topic of recovery and person-led services, and how do we look at empowering the workforce? And when we're talking about empowering the workforce, we're talking about the whole workforce, all of the different people who are working with those who are experiencing substance use issues. So our title is Working with Substance Use and Trauma and Mental Health. And so what are the resources that we at NHS Education for Scotland can offer? My name is Laura Freeman. And Lynne Bradford is working with me. I'm the principal educator. Lynne is the educational lead. I'm going to go pretty quickly through the first part, and then we'll slow down and have a chance to talk more in depth about some of these different pieces. But I want to start out with the themes. So if I go to the next slide, please. And I loved how these three words came up in the word cloud that we had from the form, and that was choice, compassion, and empowerment. And so what we're looking at with the work that Lynne and I are doing is how do we develop those resources and the training opportunities for everyone in all of your different roles working with substance use, trauma and mental health. And so we're looking at accessibility for everyone, and multiple ways of accessing resources, because different people in different roles will want to access resources differently. We're also looking at a pathway of training within a topic area. So if you have a topic such as core skills of relapse prevention and recovery management, you have a range of different resources. You can do some introductory e-learning, you can do some more intense e-learning, you can do online seminars, or you can take a face-to-face training that's more intensive in terms of skills. So we have that pathway, and we're looking at workforce development resources, and we're looking at all of the different levels that people need those different resources. So that might be people who just want an introduction and a more information and informed level. It may be people who want more specific skills, but it may also be the enhanced and specialist areas. And that's important to us because we are looking at the continuing development of skills. I think we can see throughout the workforce how people may start out with just wanting a bit more information and that informed level, and then continue through the years, through 10, 15 years, to develop their role in terms of working with substance use, trauma, and mental health. What we have done is we've mapped all of our resources to the MAT standards. So it gives you a really quick way of looking at our resources and thinking, if I want to develop my skills or my information in terms of MAT 6, MAT 9, or MAT 10, and we're going to talk about these as we go through, that will guide you to that area. But I think, and this is where the speakers before were so eloquent in terms of this. We need to, in our training, always directly explore attitudes, and it's how do we address that stigma? How do we look at the creative ways within our services to develop that sense of compassion and empower people? So next slide, please. I think one of the things that's interesting to me is that we need to actually pin everything that we do in terms of the MAT standards. And I'm just in terms of MAT Standard 6, I thought I would just very quickly remind us that MAT Standard 6 says the system that provides MAT is psychologically informed. And in Tier 1, and routinely delivers evidence-based low-intensity psychological interventions in Tier 2. And then really importantly for this conversation, that we support individuals to grow social networks, just like the photos we just saw. So that's MAT Standard 6, MAT Standard 10 is that all people receive trauma-informed care. And a part of that is what are the psychosocial interventions, because these two work together. So what are the psychosocial interventions? I think that, and I was just struck by this as I was listening to the last presenters, because we need to look at what do we mean by psychosocial interventions. One definition is that psychosocial interventions for mental health and substance use disorders are interpersonal and informational activities, techniques, or strategies. So we're talking about people getting together and learning information or learning strategies, learning things that they can do, and that we're going to target health, we're going to target behavior, we're going to target how people think, we're going to target emotions, the interpersonal relationships, social, environmental factors, and our aim is improving mental and physical health functioning and how people are living. So as we look at this, I think we have to define the range. And as we define the range of psychosocial interventions, think about the last conversation that we were just having and think about how this fits in to that definition and then this list. We are looking at low intensity psychological interventions, and I'm going to come back to this. I'll give you 2 examples in terms of what we mean by low intensity psychological interventions and the work that we're doing at NES. But we're also looking at activity-based and meaningful activity in structured interventions. And I think the walking group was mentioned, wasn't it? That to me is one of those examples of an activity which may be that structured activity that helps people in terms of their mental and their physical health. We're talking also about lived experience, peer, and social network structured interventions. And we're looking at physical health improvement. We're looking at family support. I think this is so important to remember that we have psychosocial interventions that surround that family support. And then we have structured interventions to meet basic social needs. Here we're talking about housing, we're talking about budgeting, we're talking about cooking. So I think as we look at this, now at NES, what Lynne and I have developed is looking more at perhaps the low intensity psychological interventions, but you will also find on our resources lots of different examples of these other psychosocial interventions that you can pull and learn more about. Next slides, please. So recently, Lynne and I have been redeveloping our resources in terms of what we offer at NES, and they're offered on what's called TIDAH, the TIDAH landing page that we've developed. I'm going to give you the information about that just here in a few minutes. But one of the things that we talked about was what is the information? What do we need in terms of what do we need reflected on our page that is important to include? What are the information, the skills, and the attitudes important for working with substance use trauma and mental health? So in terms of the psychological interventions, we have a course that is open to everyone. We're looking at the core skills of working with substance use, mental health, and trauma. And in terms of the core skills, we're looking at motivation, preventing relapse, and very importantly for this conversation, we have a module on recovery management. And I think this is a really, really important one. I know there are a lot of different resources out there, and we actually link to the SRC resources on recovery also because they've done just a brilliant job in terms of developing that. What we look at in terms of recovery management is what are some of the specific psychosocial interventions, the psychological interventions that really focus on how do we help people develop a rewarding alternative lifestyle? How do we help people move forward in recovery? We also look at motivation and motivational interviewing. Motivational interviewing is absolutely an essential part of all of the work that we do within this field. And as we look at motivational interviewing in relationship to this conversation, I think motivational interviewing encompasses that sense of choice, of compassion, and empowerment. And so it's a really good psychological intervention that provides a structure for how do we deliver that? How do we deliver choice, empowerment, and compassion? We also have a whole set of resources on trauma and substance use. In terms of mental health, I think it's really important to point out that MAT Standard 9 says that everybody with mental health difficulties and a substance use issue should have those services at the point of contact. And so this is one of the things that we do. We have a whole section on mental health difficulties and substance use where we cover the whole range. We also talk about physical health. And very importantly, we talk about children, families, and parenting. And one of the things that I was really struck with in the last conversation was the needs of women and the importance of making sure that women know what the choices are and that there are different choices, and sometimes that a residential program is a really important choice to offer women. Reducing harm and stigma and reducing alcohol and drug-related deaths are really the core of what we're also talking about. So these are the topics that are on our TIDAH pages. And this is what, as we've looked at the field, we feel like there's a really, real important point here in terms of thinking very holistically about what are all the needs that people have and how can we provide those resources, that information that the field can use to basically empower and provide people choice. Next slide, please. So online training resources by level. And one of the things that we've done is we've looked at what's that informed level, what's the introductory level. And in some of our different sections, you'll see this very explicitly broken down. One of the things that is a really important e-learning module is we have an e-learning module on the essentials of psychologically informed care. Again, going back to MAT Standard 6, if you want just a good introduction, there are 5 modules, so it takes a while to work through all of it, but it gives you a good overview of those essentials to psychologically informed care. We also have a lot of introductory trauma resources that are on our pages. So as you're looking at what is the information, what are the choices, what are the options for people, we have a number of resources on there. We also offer online seminars where we're looking at substance use trauma and mental health. And these, again, are open very widely to people within the workforce. In terms of the introductory piece, we also have a range of e-learning modules. So we have introductory motivational interviewing, assessment formulation, preventing relapse, the recovery management that I mentioned before, the trauma that I've mentioned before, but also very importantly, thinking about the range of issues and the range of people that we're working with. And I was struck by the age, the age lines in terms of the chart. Is we're going to be developing soon a module on working with older adults. We're going to have more resources looking at working with families that we're looking at getting developed. Also cognitive impairment. How do you help people who are having memory issues, anxiety issues? So these are all the introductory pieces. Next slide, please. So as we look then at the skilled level, I'm just going to go over this really quickly because Stephanie has appeared on my screen. And we have skilled resources, so you can get skilled resources in terms of the psychological interventions that we've mentioned, including motivational interviewing, where we're looking at motivational interviewing And again, that issue of compassion is so very important with this. And we also have the core skills, which provides that structured psychological intervention looking at recovery management. Very importantly, we also do training of local trainers and coaches. And so safety and stabilization is one of the trainings that we're um, delivering a training for trainers, training later on in this month, and that will train up people to deliver this in the local area. Safety and stabilization is a skills-based psychological intervention for helping people develop that stability in terms of trauma and develop safety. Okay, next slide, please. When you're looking at ways to access, you'll have these slides. And so our landing page is working with substance use trauma and mental health. And we have the NES resources for training, NES resources and training for the Scottish workforce. And you'll have the address right there. Now, the thing is, you do need to have a TIDAH account, but TIDAH is available for everyone within the field. You can sign up for an account at the link there. And what you need to know is that it is a very, very easy to access a resource. All you need for an account is an email address, and then you can sign up for a TIDAH account. For face-to-face training and online seminars, you can go to the link there, and you can find the seminars by topic. Next slide, please. Just I'm going to finish up by saying, in terms of staff well-being resources, we think that staff well-being is essential in meeting all of the 10 MAT standards. You can't actually deliver the MAT standards without also taking care of all of the workforce. And that includes everyone in every role that they're working in. And so we do have a section for well-being, and we have a NES well-being planning tool. And next slide, please. I think that's the final one. So yes, thank you very much, everyone. Stephanie, I'm sorry I'm a minute over, but I was working to get through on time.
No, that's great. Thank you so much for that, Laura. It was really helpful to hear, and hopefully it has signposted people to what is available through the NES website and through TIDAH, well, sorry, through TIDAH. There is, I like that, some questions in the chat like that, just for time and just allow everyone to get a wee break. What we'll do is we'll collate those through and get responses back out to you. Lynne, I see you've responded in relation to who can access the training, so that's been really helpful, because like that, it is important to just, you know, share the fact that it is available to everyone. You know, thankfully it's not limited just to people with NHS accounts or anything like that.
Yeah.
So I will let you all get a wee break. As I say, we'll return back at 12 o'clock and hear from Frank. So yeah, please do take a wee bit of a break from your screen if you can. You know, get something to drink, or you know, just have a gentle wee wander about the house. That's my plan. Just again, in the elements of protecting our well-being, basically. So yeah, I'll see you all back at 12. Thank you. Welcome back all. I hope you all had a chance to get a wee break and a wee bit of a refreshment if needed. As they will resume the session now with Frank, who is going to share a bit around how they're supporting people to individualise and build their own pathways to recovery. As I said, Frank hasn't got sort of slides to present, but he is just, I'm going to allow, oh goodness, I will find my tongue. We will put a spotlight on Frank so you can see him. And as I say, please do utilise the chat function as he's speaking for any questions. And hopefully, as I say, we will try and get some time at the end for some Q&As as well. So Frank, I will pass on to yourself, allow you to do probably a better introduction than I've done of yourself.
Thank you, Stephanie. I'll just time this. Afternoon, my name's Frank McDonald. I'm the Criminal Justice Lead of our section, our charity, Kairos Community Trust. So just a brief outline. 28 years ago, we started as a soup kitchen in Clapham in southwest London. There was a death in the local area. A priest opened a soup kitchen and it just kind of evolved from there. So we're the only provider in the UK that has the full pathway from detox right through to move on. So you've got 4 stages of that, which is your detox, primary treatment, aftercare, and move on. So my section that I work with, I've managed 3 projects in North London for ex-offenders, long-term offenders, mostly lifers up here, and we get them, rehabilitate them and get them back into the community. Obviously my remit is that they don't reoffend, but across the board is we're a abstinence-based charity. We believe that's the way forward, is abstinence for long-term recovery. I'm a product of this environment, prison, homelessness. I came into treatment 2 decades ago in Methven Road, our primary treatment centre, and I've stayed clean since 2004. So my own lived experience obviously kind of rocketed me into this kind of work. So I started to study, and my passion was for helping ex-offenders. But our criteria is 18-year-olds to 65. We take people for all across the country. Self-referrals we get for treatment centres all over the country. We've got the best success rate of people staying clean. So when they would come to our section, so we've got 29 houses across 6 boroughs in London. So at the final part of that process and the move on, they would be here. They could be here for up to 2 years to train and obviously after a long period of entrenched addiction, we're a therapeutic community for addicts who are homeless. So when you've been in that entrenched addiction, as we all know, it takes time. You know, and I think that's the beauty about Kairos, is we give people time through that process. And every individual's different. Obviously, I've never worked in my 18 years experience of working here. I've never worked with 2 addicts that are the same. You know, so we individualise their programme. My section up here, obviously, these guys and girls have been away for a long time. So I would pick them up in treatment in prison and start to work with them through parole hearings, and then I'd bring them into the community. Obviously, a lot of these guys have not seen mobile phones. They can't use a washing machine. Just the real basic learning things that I think I take for granted, certainly. So it's just about rebuilding their lives to suit them. You know, I work with lots of organisations. I get lots of support for the local community. Work with the local police here in Brent are absolutely unbelievable ways, because a lot of these guys are MAPA. So The other sections of our organisation are for people who are no ex-offenders, would go into different projects. We've developed now, obviously with the drugs and the younger generation, a kind of ketamine and skunkweed. There's the psychosis is just went through the roof. So we've now got a dual diagnosis section as well, where we've got 3 projects where we've got a couple of mental health workers, coupled with a couple of addiction workers there as well, for the higher need client, you know, and what's developed. So when I started here in 2005, we had 10 houses. Now we've got 29. We're in the process of buying another one, just to try and meet clients' needs. And what this one we're going to open up is for females under 25, because the referrals that we seem to be getting through are young working girls on the street, just taking them out of that entrenched addiction where they just, you know, the 2 girls spoke about it right at the start of their workshop, you know, about a wee bit of compassion. These people have just never accepted a wee bit of love, you know, and a bit of compassion. And the beauty about our service is I don't need to hit any targets. So it's totally for the client, you know, and I've been hen hunting with different organisations in prison stuff, but this charity here for me is just, it's an incredible place to work, because it's all about the client. It's no money driven. The houses that we have, the 29 houses, are covered by housing benefit. So the only funding that we have is for our treatment programme, our primary treatment programme, which is £610 a week, which is incredible for London prices. You know, it's the cheapest treatment in England. So it's no driven by that. So what we're driven by is working with the clients and supporting them in their needs. And the success rate, my success rate here since COVID with all these long-term offenders is 84% of them have stayed clean in the last 3 years. So that's just unheard of in the UK in treatment. And of course that starts through the process of me, that referral process and my assessment process. So it's quite stringent to get in this section, because if people are not going to come into abstinence-based recovery, this isn't the place for you, you know, and because of course the risk is that the recall, you're going back to prison to, you know, some of these guys are on IPP sentences. It's a different law in England, where they're on 99-year licences. So some of these boys will not see a parole hearing for 4 years if they get recalled. So just like the other speakers have spoke about relapse prevention, so I have a couple of psychotherapists work here with me. I've designed a project here that in a programme to stop offending. I think if we stop the addiction, we stop the offending, you know, and the results, as I say, just they stand for themselves. And the rest of the projects, we're having an AGM in a couple of weeks, so the figures have just come out. We've moved 58 people on successfully this year since October to October into their own accommodation. So that pathway has just, you know, it's just kind of blown all statistics out the water this year. The stumbling block here in London is that it's the same in Glasgow, of course, you know, that housing is a real stumbling block here, because of the amount of people that are here and live here. But we've always seemed to be able to pull something up for somewhere. It's, I don't know how, it's just amazing, really. And what we encourage the guys to do here and building that pathway is at the end goal is that they're going to find their own accommodation, you know, and no go back to that entrenched addiction and death, unfortunately for some, you know. So it's, I'm going to just leave it there and answer any questions. I'll leave 5 minutes for questions, because I think it's important for people, if they want to ask us anything about our service that I can answer. So I'll just finish it at that. Thank you.
Sorry, I've just lost something. Great, thank you, Frank, for that. That was really helpful. I'm just double checking the chat to see if there's any in particular at the moment. One just in regards to share your contact details, so hopefully that's okay to do that. But yeah, if there's anything that people want to sort of jump in with, even just to make some comments or reflections on what Frank has shared, or like that, if there is any specific question that you would like to ask them in relation to what they're doing. Caroline Buchan is asking if there's any link in with Housing First.
No, what the process here is in London, it's different for Scotland, it's different laws. But what we're Recovery Housing First, and then that end the product that we get over 55s, we can house. Housing associations, we've got a couple of links in there, but for the younger clients, because they're all single as well, it's very, very hard to get housing for them. So it's private rent a lot of the time, affordable.
Great, thank you. Wendy, excuse me, Wendy said is also asking around any outreach after they leave the supported accommodation, sort of any outreach to support them further.
Yeah, there's it. So, for instance, one guy left here last week, and I would go and visit him for the first 6 months. I would visit him in his own property once a month, sorry. But we do have an open door policy. So if they come up against any struggles in the community, maybe benefits or when they go back to work, any council tax or anything like that, we would still support them. So I've got an open door policy here where they can come back.
Great, thank you. And presumably is there no sort of restriction on that sort of thing? Do you know, it's not like they'll end up kind of disengagement sort of from yourself if there has been engagement for them, or as you say, is it very much sort of long-term open door?
Aye, it's open door. I've had guys come back here after 7-8 years. We encourage them to come back, to encourage the guys that are here to share their experience, you know. But 7-8 years, people come back here. They might have come up against a wee bit of a problem with their rent or stuff like that. The rent's the big one when they go back to work. That's where they kind of struggle if they're getting paid monthly or stuff like that. But yeah, we have an open door policy, and we encourage that because that's part of the charity where we've taken them for the street. You know, we just don't, right, that's you in your own accommodation, move on to the next one. It's not a conveyor belt, you know. And I think that's what's so unique about us. You know, there is no cut-off point.
Definitely, yeah. No, that's helpful just to sort of, because I know that's some of the challenges that Beaconside face when engaging with different services, and that is that sort of cut off in terms of when support kind of starts and ends, and like that as well. It can sometimes be dependent on the engagement of the person as well. So no, really, really positive to hear. And there's obviously comments coming through in relation to, you know, hearing about the service and the work that you've done there. So that's great. Thank you so much for joining us. Is there any further questions that anybody wants to ask Frank at the moment? Just pop your hand up or just as they pop it in the chat. I think we're okay for now, but obviously if there is anything that you think of latterly, you know, please do, as I will share Frank's contact details with the rest of the materials from the session, and we'll get you in touch with you, Frank, to kind of discuss anything further or like that. If you do sort of think of something while we're still on this, please do pop it in the chat and we'll pick them up as well. So that's great. Thank you so much, Frank, for sharing that information and about your service. And yes, I'll move on to our final sort of section for today. So this is from Tamara Thorne from Population Health Analysis within Scottish Government. As I say, she's just looking to speak to yourselves briefly about the stabilisation consultations that's currently underway, and share a link to the survey with yourselves as well. So Tamara, can I just pass over to yourself, please?
Yes, hi. Thanks for giving me a wee bit of time, and I won't keep you. I'm aware it's getting close to lunch and people probably want to head off. I'm one of the analysts, the social researchers within the substance use analysis team in the Scottish Government who supports drug policy and alcohol policy. And at the moment, we're conducting some research to better understand the support that's available in Scotland for people who use alcohol and drugs and are at a point of crisis with regards to their substance use. So that includes stabilisation, but also detox and other forms of crisis support. And in order to do this, we've currently got a survey in the field, and I asked for a little bit of your time today to flag that and to share the link with you. So we're wanting to go out to anyone in Scotland, any service in Scotland, however they may be funded, who may provide either stabilisation or detox or crisis care, crisis support. So I'll share the link in the chat with you just now, and I will also share with the organisers a cover email with some more information. But if there's any questions just now or any after this meeting, please don't hesitate to get in touch, and many thanks in advance for completing the survey if you're able to do so.
Great, thank you, Tamara. Yeah, if there is any questions just now, obviously we do have a wee bit of time if you want to ask anything as we're in the room to Tamara. I say the link should now be in your chat there, but like that we will share it laterally as well with the post-session materials. But if there's nothing in particular coming to mind at the moment, if you're wanting to reflect a bit more on what you've heard today, or like that in particular in relation to the survey as well, I'll just bring the session to a close, and I'd give you a wee bit of time back, and hopefully get you to your lunch a wee bit earlier as well, if that's been built into your day, hopefully. So thank you again to all of our speakers today. It's been really interesting hearing from the different aspects, and like that, also bringing that perspective as well from sort of south of the border. I think it's important to look at what we are doing, within Scotland, but looking at that national picture as well and seeing if there's anything we can glean in terms of practice and learning from there. Thank you to everyone who has also attended the session. As I say, it's really good to see so many people in the room. And before you go, we would be really grateful if you can complete the on-screen poll that should be popping up with you now, just so as we can reflect on what is working well and maybe what's not working quite so well, so as we can improve our future sessions. As I said, we will share the slides and a summary of today's discussion, and also pick up any of the questions that we haven't been able to get to today. So we will pick them up with the speakers and share that with you laterally. And yeah, please do kind of email us if you need to, if there's anything you want to raise or discuss in more detail. I'm available via the his.matt@nhs.scot email, or my own email is also stephanie.stewart3@nhs.scot. So lastly, thank you again, everyone, both speakers, presenters, and everyone, speakers and attendees, and all my team working away in the background to hopefully make this as smooth as possible. And yeah, enjoy the rest of your Halloween and the rest of your week. Thank you.
Thank you.